Talk a lot about, using a dummy thumb, which is just one thumb on top of the other, so you're using one to move the other. So we'll do superior and inferior first, because they're sort of, in theory, the easiest. Good palpation skills, right? You gotta find where the clavicle attaches to the sternum, and you'll feel a little knob there, right? It'll be a little different on everybody. So if you feel it with your thumb, okay? Now I'm on top of it. Now to move superiorly, I gotta get underneath it. Agreed? So just kind of roll down. See how I did that? Just roll underneath. Now you want to be careful, right? You don't want to feel like the patient's being choked out here. So you have to be aware that you're in a sensitive area, right? Especially male, female. So, if you tuck your fingers in, come underneath with the dummy thumb. I usually grab a little bit of the upper trap, come up underneath, and you're just going to put a little upward force. So it's basically just bringing your hands down to allow your thumbs come up. So come over the top, roll down underneath, get the dummy thumb on there, and then you just kind of roll it up. So there's superior. You could also get a nice staggered stance and just lean forward a little bit. That would work. Again, just be real aware of where your offhand is. So that's superior. Inferior, you're going to do a little bit the opposite. Okay? You can absolutely use the thumb. If you wanted to use the dummy thumb, you would have to come way up here. I find that quite difficult, but again, Stephen Francea may show you a little bit different technique, but I tend to come right on top again, drop over the top, and I kind of use my, index finger and middle finger, kind of come underneath, and then I pull a little bit of a pull downward. So again, tuck here, get up underneath, a little bit of a downward force. So we're moving inferiorly.
Thank you.
Posteriorly, do it a little bit, just so you get the concept. But again, I don't know. Do you do a lot of posterior AC? I can't think of the last time I ever did one, because it's compression, right? But you just come over the top, and it's just going to be a posterior force. Now, to do anterior, this one's a little tricky. You got two choices. One is trying to hook up underneath the clavicle. Kind of come in up underneath again. Pull forward. Okay?
You balance here. Hang in there.
I do that. It's not the most comfortable, because you got a lot of delicate musculature in there. You have scalenes in there. There's a lot of soft tissue in there. And in theory, you're not really on the sternoclavicular joint. You're, right? The sternum's here and here, and this is the clavicle out here. If I'm coming in here, it's not truly an anterior mode, but it kind of works. But a real anterior mode, is getting a hold of it. So you're pinching it. Then you're going to take some sort of grip. I usually do a little bit of a pincer grip. You're going to put a little downward force on the sternum. So I'm grabbing, so again, right? Collarbone coming out. You're grabbing with the fingers, and then you're pushing the sternum posteriorly. So in theory, what's happening is you're stabilizing the clavicle, and you're pushing the sternum away, so it's an anterior mode. Does that make sense? Typically, I don't know how it felt to you. Typically, it's like, do you want, what kind of lousy meal do you want?
Better.
But it's a lot better, right? It's a little bit of pressure, because you do have to grab it. But once you grab it, the downward force on the sternum is typically much more user-friendly than trying to hook up underneath the clavicle. So let's start with that. Okay, you're going to